healthcare affects everyone at all ages. And especially if you're going through a really big life event and you have a major injury, having good healthcare is obviously going to be top of your list. And I wanted to sit down and share my story because my husband has actually gone through a massive health crisis over the last few years, and we finally were able to get it fixed. But I just wanted to sit down and kind of talk to you guys about the experience we had and all of that kind of stuff. So today we're going to be talking all about my husband's experience getting back surgery in Poland. So we're going to be showing you some videos of the hospital. We're going to be talking you through his experience, and at the very end of the video we'll do a Q&A with him talking about how he's feeling. Is he glad he got it done, etc. So if you guys are interested in learning more about the healthcare system in Poland and our experience with back surgery and the hospital stay here in Poland, please be sure to stick around until the end of this video so we can bring him on and just really grill him with some important questions. But before we get started, be sure to hit the subscribe button and hit the like button, because that helps me know that you guys like this kind of content. It also helps the YouTube algorithm knowing that these videos are something that you find interesting. So let's go ahead and get started with everything to do about back surgery and more specifically the healthcare here in Poland. Big caveat, we went to a public hospital in Poland because the private hospital was very expensive. We went public because NFZ, which is the national insurance, ended up covering the surgery because we have a business here in Poland, so it covered all of that, which we are incredibly grateful for. But if we would have gone private, maybe the experience would have been different. So I actually did a video about this a few years ago on my channel, kind of comparing healthcare between America and Poland. And at the time, we had only really done like primary healthcare. And the healthcare that we have here is through LuxMed, and we had just pretty much used them for general checkups, so like the dermatologist or women's health checkups, that kind of stuff. However, over the past few years, my husband's actually developed quite a few back problems. And so it's just been continually getting worse. And he went into our LuxMed provider and just kind of asked, what could be done, like seeing a GP, seeing like an orthopedic guy, going to physical therapy, all of that. But like nothing was getting any better. It was pretty much to the point where he couldn't bend over. He had a hard time sitting, standing. Any kind of extra movement felt like his whole back was being pinched. And like it got really bad over the last few years or so probably ever since 2020. He went to go load the dishwasher one day and he couldn't walk for a week. He went to go pick the dog up. We have a pug, and he went to go pick him up. Again, out for a week. Just like basic things that a 30-year-old male should be able to do without pain or worrying about if something is going to go wrong. And that's really where things just kind of escalated, was each time he threw his back out by doing something so basic, the problem just kept compounding. And so he was pretty much just like, enough is enough. And he decided that in the fall of 2023. So we had been doing a lot of traveling, with more specifically a really long flight over to the US. And so when we came back, he was just in excruciating pain. Like he couldn't move, he couldn't walk. Everything was just awful. He's like, I'm tired of living this way. I've had chronic pain for years. I'm tired of this. So he made an appointment again at LuxMed, but he went to a neurosurgeon, and she said, wow, you have a lot of problems on your back. It looks like you may have some herniated discs. Let me get you an MRI and an X-ray, and then I will give you a referral to speak to another neurosurgeon who will actually be able to do like the surgery. So within 12 hours of him meeting the initial consult doctor, he had the MRI and the results in hand. So here in Poland, you can actually get the MRI results done the second that they finish the scan. So they'll just give it to you in a CD, and then you can just look at the results yourself at home. And then, you make a follow-up consultation with a doctor, and they will actually go through the results with you. And so I was just so pleasantly surprised to get the MRI results within 12 hours. Because my experience in America, usually you have to wait months and months to even get the MRI because you're talking with insurance, and insurance is asking your provider, will we cover this? Do we not cover this? Going back and forth, all that stuff. But here, just get in and you get the results and you're done. And to me, that's really amazing. And that's one thing that I love so much about the healthcare that we personally have, because it really has been able to open a lot of doors for us, and we can get things done very quickly. Once he got his MRI results, he had a few consultations with 2 different neurosurgeons, and both neurosurgeons looked at their results and were like, how are you walking? You have 3 herniated discs in your low back. I am so surprised that you are functioning and that you are living life the way you are, traveling and, going to the gym and like doing everything. Like, how are you doing this when your herniations are so bad? And so one doctor was able to get him in for surgery in 2 weeks at the beginning of December 2023. Shocked. I could not believe it. I was so excited because, again, my experience in the US is it can take weeks and weeks and weeks, even months, to get an appointment to go get surgery. And we were just so shocked that it was within a few weeks of surgery. So they gave him some pain medicine as well as a nerve regeneration pill, which shocking to me that they would even do that in America. Usually they will just give you really strong painkillers over the counter, like oxycodone, that kind of stuff. And here, very mild painkiller, but a nerve regeneration pill as well, and a muscle relaxant. And that's crazy to me that they would give you different types of medicine compared to just a really strong narcotic. Once we made the surgery date, they gave us, the location and the time they needed you to be at the hospital for surgery and all that kind of stuff. So that morning of the surgery, we left home around 6 a.m. because the hospital that the doctor was operating at was over an hour away. We get to the hospital and it was shocking to me at the level of quality that we saw. I'll be rolling pictures here so you can kind of get the gist. It was terrifying. Had I not known the doctors were so amazing, the equipment was top notch, I would have turned around and paid for the private hospital because I would not have trusted anything that I saw based on the experience that we had. So they wouldn't let me as the spouse go in with him. They basically just let me check him in. And then after that, they're like, you need to go. There's no spouses. There are no visitors. You cannot be here. So that was a little shocking to me. He was there for 3 days. That was pretty traumatizing, especially for him to go through surgery on his own. And I'm a very strong believer in having personal connections at the hospital, especially if you're going through surgery. It's very lonely. It can be very mentally taxing if you are going through medical things all by yourself and there's no one there to be with you. And so I was very adamant about trying to be there, but again, they would not let me be there. So basically when he went to the hospital, they didn't give him a list of anything to bring. So we just showed up with some clothing. And I really wish that they would have told us what to bring because they had no towels, so you couldn't shower, which is crazy to me. They didn't have any good food. And I am shocked about the food that they served. Again, I'll put some pictures here, but I think it was like a tomato slice and bread one night and then pickle and cabbage and bread another night. And it's just like, protein is the most important thing, especially if you're recovering from surgery. And the fact that this is what they served you, like, I know that budget cuts are happening, but where's the protein? Like even a protein shake or something, anything is better than a slice of tomato and a piece of bread. But yeah, like you could definitely tell that the budget cuts were happening or that they didn't care about the appearance of the inside of the hospital or even like the hospital rooms. My husband is 6'5". He was on a metal bed. There were no adjustments. They didn't have like the call nurse option on the bed. You had to actually go across the room, touch the button to ring the bell to get the nurse. And if you just had back surgery, you can't move. So like, how do you know? How can you tell the nurse that you need something? No one spoke English either. And so we were really pulling up the Polish and trying to really get our point across because no one spoke any English. And that was incredibly intimidating because while we have been taking Polish classes and we are decent at Polish, like at the B1 level, that is not medical Polish. That is not telling you exactly what I need and where I feel pain and how you can help me. So that was really hard. And, props to him for doing so much of that work on his own because that is just so awful to do, especially when you don't feel good, you're just out of anesthesia, you're in pain, like how you can't reach the call button for pain medicine or anything. So honestly, very crazy, but I will let him tell you more of his experience here in this Q&A. But yeah, that was ultimately the experience. I would say differences between what I experienced in America versus what I had here at the Polish Public Hospital. I never thought I would say this. I almost think the American system is better in certain aspects. So in America, the hospitals look better. They are like, the aesthetics make you trust in the doctors. They have big windows. They have chairs for visitors. You have rollout beds for people to stay in the room with the patient if they so want. There's privacy galore. Even though a lot of rooms will have two to a room, there's a privacy screen. And so you'll have one patient on one side, the other patient on the other, but a huge screen so you don't actually see the person next to you. And again, there's chairs and like rollout beds and everything that people can stay in there with their loved one. And that's amazing. When I was there in October visiting my grandparents, again, he just had knee surgery. And so we could be there at all hours of the day. They had no problem. You could ask questions. They could talk to you. The health professionals were very friendly, and everything was brand new and up to date. And I know that American healthcare, like, it's for profit, and like, that's a whole nother topic, but it just made you feel comfortable when you walked in, that the doctors and nurses knew exactly what they were doing, because the environment itself was a lot more comfortable, and it was made for visitors as well. And again, you can go through all surgery and everything like that, but if you're by yourself, it takes such a toll on you mentally. And I am such a strong believer that your mental health is just as important as your physical health, and having visitors is a huge thing for your mental health. And so I never thought I would say that, but the American healthcare system did seem better in that respect than it did over here in Poland. Another thing that I thought was better in America, again, I never thought I'd say this, is the food. I never thought I would say that the American food in the hospitals are better than what they served here at the hospital in Poland. Never in a million years. Again, maybe it's different in private hospitals. Public was just absolute. I never in my life have I seen someone just get a tomato slice and a piece of bread. Ever. Never. It was just nauseating to me to see that. At least in the States, they would give you like a menu and you could choose what you wanted off the menu. Obviously, you'll have just like random meals come through, like breakfast, lunch, and dinner that are already kind of like preset and predetermined for you based on your dietary needs. Like if you just had heart surgery, or you have liver cancer or something like that, of course, your meals will be a little bit different. But for the most part, you're going to have a menu, and then you can get something different if you want based on the menu that they've already provided for you. So there were a lot of options that were better than what they offered here in Poland. I'm not going to say American food in the hospitals are the best thing you'll ever have. Absolutely not. There's a lot of stuff that I find to be wrong with American food in the hospitals. That's a whole other video in and of itself. But at least what I saw in America in October versus what I saw in Poland in December of the same year, vastly different. And in that case, I would prefer America. However, those are the only two positive things that I have really found out about the American hospital system. The Polish hospital system, albeit very, very outdated, like from the 1970s, everything was top notch. The doctors, incredible. The equipment in the OR, out of 2035, it almost made Grey's Anatomy look outdated. There were so many things about the Polish hospital and the healthcare professionals there that blew America out of the water. Again, those are the things that matter the most. However, the aesthetics make you have confidence in what is actually inside. And if the aesthetics were even just a little bit better, like better paint on the walls, or new sheets on the bed, or towels for the patients, that would go a long ways in making you feel like they know exactly what they're doing. And that was really like my main gripe with it, is I'm not mad at all about the surgery. I'm incredibly grateful that he had his surgery. Everyone has said that that doctor that he had was probably the best doctor that you could ever have for this type of back surgery. But the experience it was something else. Okay, so now that you've listened to me ramble for a while, here is the man himself. This is my husband, Andreas.
Hi.
And we're going to be going through just a few questions. So how would you rate your experience at the Polish Public Hospital?
Honestly, not good. For everything except the surgery. So like my surgeon was Dr. Sabanski, like as Sarah may have told you, one of the best in Krakow. He's very skilled at this, done it like 1,000 times. And the operating room was great, brand new. The room was old, the bed wasn't very comfortable, the food was not amazing, to be honest with you. Some of the nurses were quite nice and friendly and helpful, and thought it was cute that I didn't speak Polish very well, but I was trying. I spoke enough to get by, and I survived. But yeah, overall, I would say that the user experience of being a patient, of the time before and after surgery, could have been better just from a comfort and enjoyment standpoint.
Well, I can say that we have someone that we know in our personal life who had a surgery similar to this in the States, but he was outpatient and you were not.
Yeah, he basically was there 2 hours before the surgery happened. And then like an hour after anesthesia, they basically just rolled him out in a wheelchair and just said bye, and then just threw him in his car and shipped him off. But I was there a day before my surgery. So I got there Monday morning. My surgery was Tuesday, and I left Friday?
Thursday.
Thursday morning. Sarah came and picked me up. So the doctor that I had, Dr. Mihao, he was very funny, spoke great English. I told him about how they do it in the States, and he said that this is not an outpatient procedure by any means, which I can appreciate. I would have rather not have been there, a full day before my surgery, because it was quite boring in the hospital and it wasn't very comfortable.
And with those pay-to-view TVs, that was something.
The pay-to-view TV was hilarious. But I mean, I get it. They want to make sure that the surgery is done well, and that, they took my blood and my blood pressure, and they did a mini psych eval and stuff like that. So I think in the States, they're way too lenient in terms of how easy it should be in terms of outpatient. But I think my experience was a bit much in terms of being there 2 full days afterwards and a full day before. I don't know. I'm not a neurosurgeon or an orthopedic surgeon or anything like that. I think my experience of don't move for a month, just lay flat type thing is a bit much.
But how do you feel like you've recovered now? It's been almost a month since your surgery. So how do you say you feel now and compared to before your surgery and even like right after?
Yeah, so I had my surgery December 5th, and today is the 2nd. So almost a month. Let's just call it a month for easy math. Before my surgery, my pain level on a good day, from sciatica, nerve pain, hip pain, leg pain, etc., everything that goes with having 2 herniated discs and a bulging disc, was 6 out of 10 on a good day, and on a bad day it was like 13 out of 10. Sometimes it was just, I would almost want to cry because it hurt so bad. After surgery, for those first 24 hours, it was like a 9 out of 10 on the pain scale.
But it was more of like the surgical pain.
Yeah, the surgical pain, just like overall body pain, like everything hurt, even though my incision is like this big and stuff like that. But now, being almost a month later, all of my nerve pain, everything is just gone. I literally have 0 pain whatsoever. It's mind-blowing. It's amazing. I wish I would have done this a long time ago. I'm so glad I did it. The pain is just gone. The only thing I'm dealing with now is just because I haven't exercised in like 2 months, and I've been slowly starting to walk around more. It's just the typical laying in bed for a month. So like my hips are a little sore when I walk. I can tell that I've lost some mobility and some movement in my low back and my hips just because I'm not moving. And now that I'm starting to exercise and stretch more, it's a little uncomfortable just, because when you haven't used a muscle in a month and then you start using it, you just get a little sore muscle and a little stiff. But it's not pain by any means. It's just a little bit of discomfort. But the real meat and potatoes pain of why I got the surgery is completely gone.
So do you have any advice for people who are thinking about getting back surgery, or anything that you feel they should know before they go into surgery?
Get a second opinion, for sure. I think that's very, very important. I think you should exhaust every resource possible before getting the surgery.
Mhm.
So that means stretching, that means exercise, losing weight, yoga, Pilates, anything like that that you can do before you cut yourself. I would say do that, because that's
As
what I
much as
did.
you can.
As much as you can. Do everything to get rid of the pain before having surgery. But if you need the surgery, like how I did, where my discs were just completely blown out and exercise and everything would not fix them, get the surgery. If you just have a bulging disc, which an MRI will show, usually exercise and stretching can kind of suck that jelly back into the vertebrae and you'll be fine. But if it's a true herniation, you won't be able to do anything. So I think the number one thing is get an MRI of the area, because that's the only way you can see it. If it's truly ruptured and herniated, you're going to need surgery. If it's not, do everything you can to not need surgery. That's what I would say, because I'm a very risk averse person, and it may be 1 out of 1,000 people have issues, but if you're that 1 out of 1,000, might be a problem, because potential side effects can be numbness forever, pain forever, loss of bladder control, like things like that. So I got lucky. I have no issues whatsoever. Mine was like textbook perfection and how the surgery should go. But I think you should use surgery as a last resort unless you have a fully herniated disc. Then this surgery will be the only thing that'll fix it. Oh, I will say something that's very important, that this is a me personal lesson that I learned, is don't get used to pain. Like, I got used to being in pain and I didn't realize how much pain I was in constantly until I got out of pain. And I didn't realize how chronic pain changed my mood, changed my thoughts, how I viewed things. Like, I was just so irritable constantly. Everything would make me just pissed off. Like, the smallest thing would just send me like into a blind rage, because I just hurt so bad all the time that I just had zero leniency for anything. And that's what Sarah and I were talking about too, is I can tell that things that used to just make me go off the deep end, I literally just like don't care anymore. And it's because I was in so much pain constantly that it was messing with my head, basically. I literally feel like a different person now that I'm out of pain. And I know that you get used to it, and don't get used to it. There's no reason for you to live in pain.
There's a reason we have nerves.
Yeah,
and there's a reason why when your body says something hurts, it hurts.
Yeah. So if you're having this sort of back pain, and it feels like whenever you bend over or do something, someone's shoving a knife into your low back at the L4, L5, go get an MRI. Don't wait. Don't get an X-ray. An X-ray won't help you. Don't go to a chiropractor. If it's a pinched nerve, herniated disc, only an MRI is going to show it to you. And if you have it, get the surgery. It's worth it. I mean, it literally changed my life. I wish I would have done it sooner. There's no reason the last 3 years I didn't have this surgery done. As I said, I just got used to the pain, and I didn't even know I was in so much pain until I stopped. And now thinking back on it, it's just like, wow. Like, I can tell you, like 2 weeks after my surgery, I was off the pain pills and I was feeling like no pain whatsoever. And I did something, and I was still, 2 weeks after surgery, so I still had to be a little careful. And I just did something without thinking, and I zinged my back a little bit. And for about 30 seconds, I was like, oh, wow. And I was like, that's how I used to live. Don't live in pain, especially when we have today's medicine to take care of it. That's all I can say. Don't get used to it.
And the last thing I have to say is make sure you advocate for yourself. If you feel that something's wrong and the doctor kind of brushes it off, like you said, go see someone else. Like, get multiple opinions, because no one else can tell you how you feel. If you feel that something's wrong, go get it looked at. But I just really wanted to film this video for you guys so we can just really talk about some differences here between America and Poland when it comes to the hospital system. Mm-hmm. And again, like in my previous video, I had only had great things to say about the Polish healthcare system, and I still have good things to say about it. But I would say my views have changed a little bit, because not everything is perfect, and no country is going to have it completely right for healthcare. I would say Poland has it better than America, but there are some things that I do feel America has done different. So, and I feel like has done a better job with when it comes to hospital and patient care and like overall aesthetics of making you feel confident in who is doing what. So I hope you guys enjoyed this video. Thank you again so much for watching, and we hope you found this helpful. Leave it in the comments below if you have had back surgery or you've had other experiences with the healthcare system here in Poland. We would love to know, and we can have some interesting discussions down in the comments below. So thank you guys again so much for watching. Be sure to give this video a thumbs up if you enjoyed. Subscribe to this channel for more videos about Poland, and we will see you in my next video.